All right, hello everyone. My name is Dr. Kieran Kennedy, and it's a real pleasure to be here with you today, or tonight, or this morning, or whatever the time is, wherever you happen to be. At the moment, for me, it's morning here in Melbourne, Australia. That's where I am from and where I'm living at the moment. As a little bit of an introduction to me, I am a medical doctor, currently completing my residency in psychiatry, and so am a soon-to-be psychiatrist. So it's a real pleasure to be here today, and thank you so much to the Living Healthy list for inviting me to be part of the message and the movement that they're bringing to all of us online and through their platform for promoting some discussions around health. And when it comes to discussions around mental health and promoting advocacy there and providing some education and info as best I can, that's something that I'm really passionate about. So thank you so much to the Living Healthy List team for having me on board. So this morning, or like I said, whatever the time is at the moment for you, right now we're going to be going through some fantastic questions that the team have sent me over. So we're just going to be chatting our way through those and hopefully tackling some really important and really commonly asked questions and themes when it comes to mental health, men's health, and also men and mental health in particular. And if we are not a man ourselves, men's mental health is still something that's incredibly important for all of us to be aware of, because, if you are a wife, girlfriend, boyfriend, partner, son, daughter, father, mother, that there will potentially be a man in your life who at some stage you might be a bit worried about on the health side of things, and so having discussions around how we recognize that and how we can support people in that space, men and women, is really important and something I'm really passionate about sharing when it comes to my knowledge and my work. So we're going to crack on to it, and forgive me for looking over at points to the questions that the team have sent through to me, but there's some crackers in there, so I'm really looking forward to getting down to them. So I guess the first one in the first place to start is a little bit about me and who I am. So as I said, Dr. Kieran Kennedy is my name, and I guess my game, if we're going to go with that, is working in mental health as a doctor. So I am a fully qualified medical doctor who has come out of medical school and has decided to pursue my specialist training in psychiatry and mental health, and I am nearing completion of that. It can be a little bit confusing in terms of the medical world and the terms we use for those things, but our residency, as it's referred to in the United States, and then in Australia and New Zealand we might term it our registrar years or our registration years, are where a doctor completes their specialist training towards becoming a surgeon, a obstetrician, or in my case a psychiatrist. So that's what I do day to day. At the moment I am working for a very busy public hospital service, and the area of work that I'm really fascinated by and that I work in day to day is the interface between physical health and mental health. So I often find myself working in outpatient clinics or on the medical and surgical wards, meeting with people and their families to look at how a physical health condition like a major surgery or an infection, it might unfortunately be a brain tumor or a neurological condition like Parkinson's or multiple sclerosis, how those those physical health conditions can impact on our mental health, and that can be everything from people becoming confused and delirious to moving through grief and depression around a significant diagnosis or a loss. So it's a really fascinating, challenging, complex area to work in, but it's something I'm incredibly passionate about. And I guess the other part to my work, and something that I do a fair bit of, is writing and speaking about mental health and advocating about mental health in terms of education, but also pushing back stigma and barriers to people having sort of access or support when it comes to struggling with mental health issues. So that is something that I'm incredibly passionate about, and at least over here in Australia, I do a fair bit of work between my hospital work in terms of writing for a few magazines, some semi-regular appearances on morning TV and things, just to discuss health topics, and especially obviously mental health topics. So that's me in a nutshell. I guess education wise and background, obviously have been through medical school, but before medical school actually did a degree in psychology as well. So talking about mental health, and now being lucky enough to work in that area as a doctor, is something that I've really been passionate about and fascinated by for a long time. So hopefully that means we're going to be able to have a really good discussion, or at least a one-way discussion through the camera here, about some of these fantastic questions that the team have popped through to me today. So yeah, we'll be really keen to hear any feedback from you guys about this clip and about this video. So yeah, hope it can provide some kind of information, some kind of support, and hopefully as well some kind of inspiration for whether it's us ourselves that are going through a difficult time for our mental health, or someone that we love or know. So what I always hope with this type of thing is that it can offer some kind of spark or inspiration for people to be reaching out and accessing help if they need it, but also to be talking about mental health and these things with their loved ones, because it's incredibly important, and it's just as important as our physical health. So yeah, that leads us nicely, I think, into the team's first question, which is that mental health issues can be really hard to understand if we haven't gone through them ourselves. So what's a way that we can help to sort of better understand mental health and mental illness, and what that means really? And I think that's a great place to start, because that's exactly right. I think for some of us this can be something that we can connect to, and that maybe we've been through ourselves. It's incredibly common to struggle with mental health at some point in our lives, and particularly when it comes to anxiety and depression, up to 25% of us, or even more, at some stage in our life are going to have gone through a significant period of struggle with those things. So this is something that is incredibly common. This is something that unifies all of us. But the frame for that question is right. If we haven't had to go through mental health struggles ourselves, or we haven't had a friend or family member that's been through that before, it can be hard to understand what we mean when we're talking about mental health and mental illness. So I guess from my standpoint, and to ground us for some of these other questions and discussion points, mental health is really talking about sort of everything that happens, I guess, from here on up, and for what's happening below the surface. And it's key to point out that what's happening mentally and in our mind is very much connected to what's happening physically in our body, and vice versa. So mental health isn't something that is completely disconnected from the physical, but when we talk about mental health, we really are talking about the thoughts, the feelings, and some of the behaviors or actions that are coming from what's moving through our mind at any one time. And obviously that's incredibly complex, but it's something that is obviously there 24/7, just as our body is. For better or worse, our mind is ticking away at all times, and with the really busy lives that we're leading these days and everything that's going on, particularly at the moment, there's an incredible amount of change, loss, stress, grief, anger, everything, and we've all sort of been having a lot of that lately. So, the way that our mind interacts with what's going on around and outside of us, but also how what's going on around us affects our mind and what we're thinking, feeling, and doing, all of that comes under the umbrella of mental health. So that is something that obviously I spend my day as a mental health doctor working with people on. It's about their thoughts about various things, about themselves, about others, about the world, about their lives in general, and it's the emotions and feelings that connect with that. And then we often talk about those two things really connecting together to affect how we move through the world. So how we're behaving, how we're acting, and then how those things in turn and how the things we come up against in our day-to-day lives feed back and affect how we're feeling and how we're thinking as well. So it's a bit of a complex melting pot, I know, but mental health can be basically anything and everything when it comes to how we're thinking about the world and ourselves, and how we're feeling about it, and then how we're interacting with it as well. So mental illness, I guess on the flip side of that, is when we might be struggling with those things. And mental illness is, breaking it down again in very much an oversimplification, but if we think about mental illness as a difficulty or a struggle with one or all of those aspects, it can help us kind of boil it down and simplify it a little bit more in our mind. So struggling with our mental health or experiencing a mental illness might be struggling with how we're thinking and what we're thinking about. It may be what we're feeling and what's triggering those feelings. And then it may also be, as a bit of an interaction with both of those things, again, how we're interacting with the world and some of the behaviors and things that maybe are being driven by some of those thoughts and emotions, and how that influences us, how it influences others and our lives as well. So mental illness is really when a symptom of the mind or what's happening mentally is starting to affect us to the point where it's making it really difficult for us in our day-to-day lives to either do the things that we want to do, or it's impacting on our distress levels, our ability to engage in the world around us, or our health in general. And sometimes that can be obviously affecting our physical health and our safety or others' safety as well. But again, I think the tricky part here, and the reason why this is such a fantastic question to ask, what actually is mental health or what is mental illness? The tricky thing can be that these are very complex things, and different to maybe a physical illness, for example, that we can see or touch. Mental health and mental illnesses is a little bit more mysterious, isn't it? And it's a little bit more complex because we can't obviously always see it on the surface, and it can be a little bit hard to pin down and describe. But generally, our mental health is what's going on the inside mentally, and that can be anything from what we're thinking, what we're feeling, and also how those things are interacting with our actions and what we're doing as well. I think it's good to point out here where mental illness comes from, and because that can help us reference what it is as well. And there are a lot of misconceptions and a lot of stigma that's still around about what mental illness means and what it is. And a lot of those are boiled up in where mental illness comes from. So I think a really important thing to point out to start with is that mental illness is in no way a weakness or a personal failing. It's not connected to someone's strength, or there is no religious, racial, gender, sex sort of discrimination when it comes to mental illness. This is something that unites us all. It doesn't come from a certain way of living or being necessarily, and it doesn't come from any sense of moral failing or personal weakness or failing. And we're going to talk a little bit about men's mental health, and particularly a little bit later on, and so I always really like to point those things out, because particularly for certain people or certain groups today, mental illness or struggling with our mental health still really has that connection with some kind of failure or some kind of weakness or inability to cope or push through. And that is not what we're talking about here. Just like a physical illness, mental illness is a health condition that can come from a whole range of things, but it is never an individual's fault, and it is never a point of weakness or failing in any way. So if that is the case, you might be asking, well, what is it and where does it come from? And obviously anything to do with the brain and the mind is very tricky and very complicated to work out, and we've seen that through medicine as well. The whole way through, our knowledge about mental illness and neurological conditions has always lagged a little bit behind our knowledge and understanding of physical health conditions. And again, I think that purely comes from the fact that often this is something really complex. We're using our mind to try and understand our mind, but it also comes down to the fact that we can't just open up this space like we can the body to look at or touch necessarily what is happening on the inside or with someone's mental health or mind. We can't touch and see feelings in that traditional sense or thoughts in that traditional sense. So this is something that has been a real challenge for medicine across our history, but thankfully it's something that we're coming to understand so much more of now, and the knowledge and the research coming out about psychiatry, mental health, mental illness is really skyrocketing, and has skyrocketed in recent decades. So we know much more now about what mental illness is and where it might come from. And some of the major ports there are the biological or physical side of things, and we know much more about how that works now. So we know that for many mental illnesses there is very much a neurochemical and a physical change occurring in the brain. For someone with severe depression, for example, leading theories and research show that there are changes to the chemicals within the brain that are responsible for our neurons communicating and regulating things like our mood, like our energy levels, like our sleep. And so for someone with depression, a part and parcel of that may be a genetic predisposition or a change that's occurring in the brain leading to those symptoms in that condition. Alongside that, obviously mental illness isn't purely a physical condition or a physical cause, and so someone's past in terms of their experiences, trauma and loss, grief, stress, things happening in the world around us and with our relationships, all of those things as well obviously feed back through and affect our thoughts and our feelings about ourselves, about others, and can influence mental health as well. And the really interesting thing is that it's most likely that those things interact. What's happening physically in the brain and body is obviously filtering through how we're perceiving and what's happening on the outside, and vice versa as well. We know now that stress, trauma, loss, grief, all of those things are in a very real way affecting the neurology and the biology of our brain, and that those things can on a very physical level start to affect how we're feeling and thinking and acting. So that's really important to point out as well. Mental health and mental illness is not a pie in the sky type thing that comes down to any kind of failing or inability to cope or needing to just harden up or move on. Mental illness is something is very much a medical condition, just like a diagnosis of cancer is or asthma is. There is no separation here when it comes to the medical understanding of what mental illness or struggling with our mental health is. So that was a bit of a ramble and fairly complicated stuff, I know, but hopefully that frames for us a little bit about what we're talking about here when we're thinking about mental health and mental illness, and it's going to help us with some of these great questions that are to come. So the next one is, where do things sit when we're talking about depression versus other mental health issues? And that's a really good one to point out too, because depression is probably one of the most well-known mental illnesses. So often when we hear someone talk about mental illness or mental health, depression is one of the key ones that pops into our mind. And with good reason, because depression is one of the most common mental health conditions that affects us today. And when it comes to some of the impacts on somebody's life and the outcomes for that, depression is a really important one that we need to be aware of. So depression obviously is a mental illness that primarily sits with mood. So depression, one of the key factors in depression is a lowering of mood. And when we're talking about mood, we're talking about the general and enduring sense of emotion that we're feeling on a longer term, day to day, week to week, and even longer month to month basis. So our emotions, for example, might change quite quickly or quite regularly depending on what's going on around us. We get an email with some great news and we might feel an emotion of happiness or excitement, but next minute the boss comes in and loads us with a whole lot of work for the weekend, and our emotional barometer there might change quite significantly and notably. Our mood is kind of the background overall sense of what we're feeling emotionally in our lives. So when we're talking about depression, one of the key factors there is that someone's overall mood is dropping to a very low place, to a place where they're feeling low, sad, flat, on a day-to-day and even obviously longer week-to-week or month-to-month basis. There are a lot of other symptoms that go alongside that, and as one of our most common mental health conditions, I think it's really important that we point that out and discuss those. So some of the other things that are really important and go along with a diagnosis of depression are things like a loss of enjoyment in the things that we normally do, and that tethers to that lowering and depression of our mood. So someone who is finding themselves in a place where they are struggling with a diagnosis of depression often notices that things that they used to enjoy, things that they used to do, or feel a sense of excitement or pleasure in, those things often lose their colour, and they're just less enjoyable. They're less kind of drawn to doing those things. They might lose interest in those things altogether. So that's another really important feature to depression. Other things are a change in sleep. So some people with depression sleep less, and that's probably the more common symptom in depression. But others, and atypically, people can sleep more when they're depressed. Energy levels often feel much lower during the day. People can have a change in their appetite where they're again more regularly losing their appetite or eating less, but for some people that change in mood and flatness can lead to a sort of a reflexic increase in appetite or eating more to sort of compensate for that, and maybe in some cases gain some sense of comfort or pleasure from that food. Thoughts about self-harm or thoughts about suicide are obviously a really serious and significant symptom that can be part and parcel of the changes that are happening in the brain with depression. So this is a diagnosis that isn't just about feeling sad or low. This is again a medical diagnosis that is including a whole range of other things, including how the body is functioning as well when it comes to our energy, our concentration, our sleep. So I guess if we're thinking about depression versus other mental illnesses, there's sort of no real comparison or versus here, but depression is one of the most common mental illnesses, and it's one of the most important for us to pick up, because obviously when it comes to keeping others safe and getting them access to supports and treatment, it's really important to pick that up early. Anxiety is really common as well, and actually statistics are showing that anxiety is now our most common sort of mental health struggle worldwide, and I think that makes a lot of sense, particularly right now with everything that we've got going on, doesn't it? But an important thing to point out is that anxiety and depression often move hand in hand, so we can feel often if our mood is moving into a low place, that anxiety can creep in with that. We can find ourselves more tense, more worried, more anxious than usual, and vice versa. If we're really struggling with anxiety, or we know someone, we have a loved one, a family member, a friend who is struggling with anxiety, that can very much interact with our mood in terms of how we're feeling and some of those other components to depression that we've touched on there as well. I think a point is sort of maybe how we recognize those things, and especially when it comes to depression. This is a question I get a lot, and something that I often talk about is, well, how do we recognize if we're depressed, or if someone that we love or someone that we know is depressed? And that can be tricky, because obviously, particularly with stigma and stereotypes, it's not something that people show on the surface all the time, and there aren't necessarily major physical changes or red flags to point that out to us. I think something to be aware of for ourselves is that if we're feeling that our mood is in a low, flat, sad space for much of the week, for most of the time during that week, that's a signal that things are changing. And obviously if something bad has happened, we've had a loss, we've had a disappointment, a breakup, a job loss, a setback, feeling in a low space and a grief related space in regards to that is completely understandable and really common. But I think it's understanding that if we're finding ourselves sticking to that space for at least a period of 2 weeks. And when it comes to a diagnosis of depression, we do have some time markers to help doctors like myself work out in general, and with what we know about certain mental illnesses, what are some of the markers for when someone is most likely in that space of a significant mental illness. There are some time periods that are important. So 2 weeks is the period for a diagnosis of major depression, where if our mood is in that significantly low space and we're noticing some of those other changes, like a loss of enjoyment and things we normally would, a change in our sleep, low energy, poor concentration, maybe thoughts about suicide or self-harm, if that is there significantly, and or if it's just something that's not changing, if we're not feeling ourselves bounce back to our usual selves and who we are, that's a very important sign to obviously reach out to someone, reach out to a loved one to talk to them about what's going on, or both, reach out to your doctor or some supports for some help as well. How do we recognize it in others? Well, I think this is difficult, and I know this is something that worries a lot of people, particularly for parents, particularly for partners. How do we recognize when someone that we really care about and love might be struggling with their mental health? And again, I think it's staying plugged into what's routine and what's regular for that person. So it may be noticing that they're just not quite themselves. And if that's tethered to something, again, like a real disappointment or a loss, but it's just not getting better, they're not kind of bouncing back to themselves as we might expect them to, that can be a sign and a signal. If they're obviously in a significantly low or distressed space, again, a time to reach out to them and to help them access some support. And if there is any ever question of risk towards themselves or others from a mental health perspective, that is also obviously a really important sign and time to be thinking that this is something that we might need some help with. Something on that note that I talk to people about a lot as well is that idea of the mind and the body interacting. And some of those more physical or basic everyday things can be important ways that we can, for ourselves and for our loved ones around us, sort of keep tabs on how we're doing or how they're doing, because those things interact very much with our mental health. So things like sleep are important. If sleep is significantly changing, or we're struggling with sleep, or we notice that a partner or a parent is sleeping much more than usual, that's always something to recognize and key in on, because there's a very strong relationship between mental health and sleep. Other things are appetite, energy levels, and like we touched on before, that regular routine in terms of what would they normally do during their day, or what would they normally do in terms of what they enjoy or get a bit of a rise out of on the weekend, for example. And I think if we're noticing someone's routine or someone's enjoyment in things that they'd normally be doing really begin to change or shift, that can signal that there may be something going on with their mental health. And so that can be a sign that we need to reach out to them and open up a discussion about what's going on, how they're doing, how they're feeling, and also support them to reach out to someone else as well. So the question that the team have put to me following that is, well, do mental health issues affect men? And obviously this is a 110% yes answer from me. Mental health issues and mental health struggles are 100% something that affect men, just as it is something that affects women. And we often talk about mental health and mental illness being the great equalizer. Mental health struggles and mental illness is something that affects everyone from all walks of life. It doesn't matter what age you are, what gender you are, it doesn't matter what the color of your skin is, or how much money you make, what your profession is, where you live in the world. Issues with depression, anxiety, drug and alcohol issues, these are things that unite all of us, and that's why discussions around mental illness and mental health are so important as well, because there is no one that is above or below when it comes to the mental health line. So definitely mental health issues are something that affect men, and in a lot of cases affect men significantly. And I think the important thing to point out here is that a lot of the way that, particularly in the past, we've framed what it means to be a man and some of those masculine norms. A lot of those things have framed a way for men to feel they need to interact with the world that blocks them from actually being able to open up about their mental health and talk about their mental health, or get support for it if needed. So we know that men definitely struggle with mental health issues, depression and anxiety. Men are more likely than women to struggle with drug and alcohol issues, anger, aggression and violence, which not always, but sometimes can come from places of struggling with our mental health. And, a lot of those sort of spaces that we see men struggle with more in terms of mental health are actually means of trying to diffuse different struggles with mental health or with what's going on inside. So alcohol and drug use or addiction issues, for example, can, again, not always, but can be related to struggles with mental health issues in another nature that are being numbed or diffused through use of alcohol and drugs. So it's something that doesn't necessarily affect men and women differently in terms of depression in men is not inherently different from depression in women, but the way those things are expressed are different, because our society and our culture has different messages that we send to men and women for how men and women are supposed to act, or how they're supposed to deal with emotions, or deal with difficulty or strain, or issues of that nature. So I mean, the next question there is does mental health affect women and men differently? And I guess that's what we've just touched on. So mental illness is not something that is necessarily inherently different between men and women. We don't have a separate classification for what depression in women looks like compared to depression in men, for example. But again, because there are some different expectations, different messages, different societal pressures for men and women, that can change and impact on how we see anxiety and depression expressed in men compared to women. And so, as we said, men may be more likely to avoid talking about difficult topics, talking about emotions, because as young men, that's something that a lot of men are taught is not something that a man can do. To talk about emotions or feelings or touchy-feely stuff is something that I think a lot of men struggle with, and that's not inherently due to them. That's often more to do with those cultural, social messages that have been sent through to men from when they were very young boys about what it means to be a man and what masculinity means. So men may be more likely to numb, they may be more likely to have sort of anxiety or depression and mood issues come through as anger and irritability. That's something that I often talk to young men about and have seen a fair bit. It can be more common for men struggling with anxiety to be much more distant and isolative, irritable, angry, whereas for women who have the exact same diagnosis, the expression of depression and anxiety may look slightly different based on what it's more acceptable for women to be able to express and talk about and feel in society compared to men. So that is some of the ways that I guess mental health issues affect men and women differently. But statistics are also something that we're seeing some difference in for men and women as well. So whereas diagnoses of anxiety and depression, for example, are higher in women compared to men, men have much higher rates of suicide compared to women. And it's likely very complex as to why that's the case. But one of the reasons that may be the case is because men are actually much less likely statistically as well to reach out or open up about mental health struggles or to seek professional help for those things compared to women. So it's, and it does break my heart every time I see a young man in my work who has really been struggling and pushing through this for so long and feeling that they couldn't get help for it or they couldn't talk to someone about it because, what I often hear is, that's just not what men do. Or I thought if I told my family or my mates about it, they would think I was weak. So it's that again, that socio-cultural context that may explain why suicide rates, for example, are significantly higher for young men in particular, and actually one of the leading causes of death in young men worldwide. So there are some differences on paper that we see in mental health for men and women, but often what we're finding is that doesn't necessarily come down to the differences in the biology or the brains of men and women. It may be more affected by the subtle sort of messages and expectations for how men and women are supposed to feel, act, react, and reach out or not when they're struggling with something. So I guess the next question, and I'm sort of constantly jumping the guns with these questions, but it shows that the Living Healthy team have really put together a sort of a great sort of few discussion points here. The next question is, I mean, society does tell men that it's at times not acceptable to have too many feelings, and what are my thoughts on this? So obviously, as I've just rambled on about, my thoughts on this are that it's something very real for men, and particularly young men still today. You know, I think we've made a lot of ground in terms of pushing back on some of those more traditional sort of cultural messages about what it means to be a man, and what masculinity means, and it is great seeing more and more boys and young men today being open to sort of think about and discuss mental health and emotions and all that side of things. But it's still something that is very much large in a man's mind, even if that's subconsciously, as boys and young men are growing up today. You know, men still are told, sort of explicitly or implicitly, that showing too much emotion, talking about emotions, struggling with your emotions or your mental health is not a manly or a masculine thing to be struggling with. And that if you are struggling with those things, you're definitely not sort of reinforced to talk about those things. You know, it's something that you should keep to yourself. And, you know, I think it very much interacts with those messages around men needing to appear strong, appear in control, sort of appear unfeeling in a lot of ways. And what we know is that that's blocking young men from getting access to mental health supports and treatment when they might need it. But it actually as well is likely contributing to some of the significant statistics that we're seeing with young men when it comes to mental illness and suicide as well. So it's really, really difficult. And obviously my thoughts on it are that it's, you know, and this isn't going to be a surprise to you, but my thoughts really are that it's obviously absolute rubbish. You know, it means nothing about a young man's masculinity or themselves as a man if they're finding themselves struggling with their mental health or emotions, or if they're finding themselves diagnosed with a mental illness. You know, as we framed right at the start of my ramblings here, mental illness is in no way a weakness or a failing. It's something that is obviously very much interwoven with our biology, and that can be our genetics, our body, but also our experiences in terms of what we've been through in our lives, or the stresses, the significant responsibilities, the busyness, the pressures of modern day life. And so just as it is for women, for men, struggling with our mental health, struggling with emotions, or having a diagnosis of a mental illness means nothing about the person themselves, and for men it means nothing about their manhood or their masculinity. So basically my feelings there are that it's absolute rubbish, and that's why I'm so enthusiastic about, I guess, spreading this message, and trying to push back on some of that stigma and some of those stereotypes that we unfortunately still sort of have running under the surface when it comes to mental health today. Is mental health more prevalent today? That's a really good question. And, you know, I guess from a statistics research point of view, we are seeing rates of mental health issues and mental illness rising, and that's fairly consistent for both men and women and for different countries. And the reasoning behind those statistics and that rise in mental health is, again, likely very complex and likely comes down to a number of different things. I think it comes down to some of the things that we're up against now in our modern life, you know, when it comes to pressure, busyness, you know, full-on work and family responsibilities. I mean, these aren't things that are new, but I think the melting pot of everything that we're dealing with in modern society today, including the internet, including some of the things that social media brings in when it comes to our mental health, I think all those things now mean people are in a position where they're very much more vulnerable in some ways to struggles with mental health, particularly with depression and anxiety. part maybe as well that we are a lot more plugged in now to mental health struggles and mental illness. And so I think we're actually, and this is a good thing in my opinion, but we're actually more plugged into getting help for mental health these days and accessing services. So some of the ways that we're seeing mental health rates rising may actually be that more people are actually presenting for help and support with their mental health now compared to in the past, and that means we're picking up higher rates. But I think in general, the pressures, the busyness, the being constantly plugged into phones, to social media, I think a lot of those things are contributing to some of the trends that we're seeing with mental health and mental illness these days. And obviously this is particularly relevant for right now, isn't it? We're moving through so much when it comes to potential pressures and impacts on our mental health from the world around us. We're moving through COVID-19 and the significant losses, strains, change that have come from that and are still coming from that. We've seen things that have, of course, always been there or been there for a very long time, sort of becoming more prominent and in our mind's eye, thankfully, recently, in terms of people suffering great injustices and oppression and things. So, there is a lot happening in the world right now as well that has the potential to be interacting and influencing our mental health. So I think mental health is more prevalent today, but that's all the more reason again why we need to sort of be stepping up and stepping into some of these difficult discussions about these things. I think what we can do to help reduce or improve the stigma around mental health, and that's probably one of my favorite questions here, is just what we're doing right now. It's opening the discussion and opening our minds to be thinking about these things. I think step number one is that message that I've been ramming home this whole time, in that there is really no separation here between the physical and the mental. Just like we would not blame or shame someone for a diagnosis of cancer or asthma, we really need to be removing that connection with mental illness in our mind when it comes to there being some kind of cause or personal blame or failing for mental health struggles, because that is not the case. Biologically, physically, we know that what's happening and underlying many mental illnesses means it's not the case that this is a choice or a personal failing or a weakness. And then again, in terms of what someone has been through in their lives and how that interacts with their mental health, just as how what we've been through in our environment and in our lives can affect our physical health too. We need to remove that stigma around mental illness or struggles with mental health being something that is a person's responsibility necessarily, or a personal failing or a weakness. So I think we can help end stigma around mental health when we're making those messages and those discussions the top priority in our minds. And I think it comes to sharing our own experiences and being willing to have these discussions with others as well. When we think about up to 25% or more of people significantly struggling with anxiety at some point in their lives, that's a significant amount of people. So if you're struggling with mental health, you're not alone in that. And if someone that you love or someone that you're looking out for is struggling with their mental health, then they are not alone in that either. So I think it's really, it's removing again the stigma and the stereotypes by normalizing how common this is and how it's something that actually unites all of us. It's not something that separates us in terms of that person clearly couldn't cope, or there's some kind of weakness or failing there, which is never the case. Because this isn't about separating people. This is actually something that unites us. And thinking about our feelings, thinking about our thinking is just as important as is thinking about, our appearance or what we're looking like on the outside, or how we're feeling and doing physically too. And I think somewhere along the lines in society, we've put a lot more attention and importance to how we're feeling and looking physically compared to how we're feeling sort of on the inside, or how we're feeling mentally. So I think the more we have these discussions and the more we think about it for ourselves and for those around us, the more we can just help to break down that stigma. So we're getting towards the end here, guys, but another really great question that the team have put through here is sometimes, even if you know that you need help, it can be tough to know where to start, either for yourself if you're struggling with your mental health at the moment, or for someone that you care about as well. So where do we start, or what do we do if we're concerned for ourselves or someone else when it comes to accessing help? I think the first thing is obviously always to reach out, and that's reaching out for ourselves if we need to, or it's reaching out to someone else. And what I hear all the time and completely understand is that, well, that's much easier said than done. And I agree. This is really difficult, personal, tricky stuff to be talking about, whether it's for ourselves or for someone else, even if it's someone in our family, someone that we're really close to. So there's often an anxiety and a worry about bringing those topics up or talking about these things to start with. And that's really understandable. But I think the thing is that it's often easier than we think it is going to be. And a really common myth that we really need to bust here as well is that this is something that we might make worse by thinking about it or talking about it. And that's something that I know parents or loved ones or partners of someone who's struggling, or when we can tell someone that we love is struggling, that's a myth that is really still kind of insidiously there under the surface that blocks people from talking. We sort of have that sense of, well, I don't want to bring it up and make someone upset, or if I bring it up, am I going to make it worse? If I ask about someone's safety, if I ask about self-harm or suicide, does that mean that they're more likely to then do those things? And what research actually shows is that none of those things are the case. So we often significantly reduce someone's risk and can positively contribute to their mental health improving if we broach the topic in a non-confrontational, non-judgmental way and just open up the communication lines. And the same goes for if we're wondering how to first start to accessing help for ourselves too. I think it's always about first approaching someone that you trust, someone that you know and that knows you, and opening up about the fact that you might be struggling right now, or that things are difficult right now. You've been feeling really anxious, you haven't been sleeping, you've been feeling really low about everything you've been seeing or hearing recently. So that is always step number one. And a key thing is to remember the importance of just listening. So if you're someone that's supporting somebody else, there's often a sense of pressure and worry around, well, I won't know what to do, or I don't know how to fix it. And I think it's really key to point out that that is not your job here. Your job is to listen, and that actually just having someone listen to us when we're in a space of struggling with our mental health can be incredibly powerful and incredibly helpful. So if all you can offer is a space to listen and try to understand and just hear that person, that in itself is often incredibly helpful and can make a real difference. And there doesn't need to be a sense of pressure that you're needing to be or do more than that. And I guess that's where it brings us to our next step, is where to access further help or support from there. And I think that the best and first port of call is always to talk about this with your family doctor or with your GP. That's often the best place to raise concerns about mental health to start with. And so again, that can be a really difficult, nerve-wracking, anxiety-provoking thing for people, but it's that sense again of there being no stigma here, and that for any doctor, particularly your family doctor or your general practitioner, this is something that they're very used to supporting people with. This is something that all doctors have learnt about. And so starting there as a first port of call to get support or some more understanding about what might be happening for you and what some supports can be for that is really, really important. There are some really good information online. There are obviously support lines like Lifeline. In Australia here we have Beyond Blue, for example. So people can reach out to those mental health helplines or even crisis services if they need to, and that puts them in touch with someone who is there to listen, but also to guide them through to maybe where they can get some support and further input from there as well. Obviously, seeking out a psychiatrist or a psychologist is sort of that next step up in terms of support and help for things. And I think it's important to point out too that there is some stigma still around those supports and professions as well. And especially for psychiatry, modern psychiatry is very much no longer about pushing medications or any kind of scary physical treatments onto people. And it's really about balancing potential medication inputs if that's where things are at and that's what patients would prefer or what we feel that they might need to help them through things, but it's also balancing talking therapy, and obviously psychologists lead the charge there, or psychotherapists do, but this is something about working with people to balance what's going to be best for them in terms of their supports. So I think if you are worried about a loved one or someone that you know, it's gently and again in a non-critical and non-judgmental way, encouraging them to reach out and take that first step to accessing some supports. And doing that alongside them, offering to go to that first appointment. Some people may feel more comfortable, particularly if it's a family member, with you making that appointment. So calling the GP or calling the psychologist to make that first step with them. So I think it's very much being with them in this journey and just being alongside them, knowing that it's your job to support and listen, not to necessarily feel that you have to fix. So it's sort of moving through to the professional supports for those things. And I guess to round us up, because I've nearly rambled on now for an hour, so I will not keep you guys too much longer. But the question that the team have put through to end on is what are 3 things that we need to know to look for when it comes to mental health and particularly for mental health of the men in our lives. So I think one of the key things or number 1 in those 3 would be, like we said, whether it's with ourselves or with someone else in our life that we care about or that we might work with, we might live with, love. It's sort of keeping just clued into how things normally tick over for them. So I think if we're noticing significant changes to someone's routine, someone's usual day-to-day, and how we would think about or describe their usual day and what they enjoy, what they like doing, how they interact, how they express themselves, I think if we're starting to notice significant and persistent changes in those things, then that can be a signal that there may be something going on with their mental health, and making that step to reach out and ask that step to say, I'm worried, I've noticed this, obviously in a non-critical way, but from a place of care. That is always step number 1 in terms of giving someone that opportunity to express what's happening for them and for you to be part of that journey in whatever way of helping them access some support and help. I think step number 2 is coming back to our discussions on stigma. So particularly for men, we really need to be getting rid of this idea in our mind that mental health struggles or mental illness is connected to weakness or failing, because 150 or 200% it is not. Mental illness never means anything about an individual's personal strength. It is never a sign of failure. And for men, it is never a sign of anything to do with their masculinity or their manhood. And so I think the more, particularly as men, we can step up and speak about struggles with mental illness, or we can talk about, what we're thinking, what we're feeling, and sharing those experiences with the other people in our lives. I think that's step number 2 of what we can do to look out for mental health of those around us, and particularly the mental health of men around us. And I guess the third thing to point out there, what are 3 things we need to look out for or remember when it comes to mental health in men, is just that fact of putting aside some of those myths around what we need to be and do if we're opening up that discussion around mental health or around touchy-feely stuff with others. Listening and being there is 80% of the battle. And whether we're a family member, whether we're a partner, whether we're a friend, whether we're a work colleague, just being in a space to show that we care and to offer to listen can make a significant difference in someone's mental health and their journey to getting help for that. We need to lay aside these myths that this needs to be about us doing something or fixing something, and we particularly need to lay aside the myth that we might make things worse or more risky if we're asking about or talking about these things. So I think for me that would be probably point number 3 there, is to never shy away about talking about these things for ourselves, or asking about and listening to someone in our life who might be going through a tough time with their mental health as well. All right, well, that is right on an hour or just over. So I won't keep you guys any longer, but it's been an absolute pleasure, being part of this today and talking through some of those really, really interesting and incredibly important questions there from the team. So thank you so much to the Living Healthy List team for asking me to come on board and be here today, and I hope that you guys have got something out of this talk, and I look forward to touching base with you and having some discussion about health in weeks and months to come. All right, take care everyone, all the very best, and I'll see you soon.